Hi, I'm Dr. Jeremy Sim from Brightside Dental,
Hi, I'm Dr. Paul Yao. I'm with Ego Aesthetics and Surgery.
and today we're just going to find out more about our respective areas of interest.
Yep.
So I heard that in terms of aesthetic medicine, is it true that the more you do, the better the results are going to be?
Okay, it might be true for certain things. So of course, for facials and stuff like that, if you're regular with it, if you're regular with your lasers, you're definitely going to get good results. Your skin will definitely be more hydrated, supple, pigmentation less obvious. But there's also a natural saturation point. So if you're going to do a facial every day, you're probably not going to see much effect. It might actually damage your skin. And with things like fillers or Botox, it can actually be overdone as well. So if you get too much fillers, that's where you get like this filler overfilled syndrome that we see nowadays, where everyone's very puffy.
Yeah, they look really old.
They actually end up looking
Yeah.
older than what they naturally look like. Or if you do too much HIFU, for example, you can become...
What is HIFU?
HIFU is a high intensity focused ultrasound.
Okay.
It's similar to things like our therapy, where we get them to help lift your face. But there can be an element of fat loss inside, as in the face as well. And if you do too much of that without consideration, then of course you can end up looking very gone and actually even more aged than instead of looking better.
I see, okay.
Alright, so not always more is better. Then for yourself, right, aesthetic dentistry is something that is coming up. So what exactly is it, and yeah, can you share more?
As the name suggests, aesthetic dentistry is really about making your teeth and your smile look better. But sometimes people have the misconception that aesthetic dentistry is really just about looking better. But the very fact of the matter is that if your teeth look good, they are probably healthy as well. In order to achieve a nice smile, you first have to have a healthy smile. For example, we're not going to build a skyscraper on top of very soft, muddy ground, right? We have to have a very strong foundation first. So that's the basis of aesthetic dentistry. So before we even get our patients to do something like a set of veneers or even whitening, we have to ensure that everything is healthy. And also, if you have a nice smile, you tend to be more encouraged to maintain it.
Yeah,
so
that's
you
true.
tend to also brush better, floss better. So it's not about just looking good, but it's also about feeling good as well.
What you mentioned about the smile is actually quite important as well, because I think that's one of the things that people see right away as well, right? Aside from eyes and scars, all that. But when you smile, that's something that really conveys friendliness, happiness. If you don't have such a nice smile, it can also impact your confidence.
Yeah, I think that goes for everything aesthetic, your smile, your face, even like you say, you have pigmentation, you have scars in your face. I think one thing that I think we both love doing is that we're not just helping patients look good, but at the same time, if we just able to restore their confidence, for them to be able to just go into public and smile and speak confidently, that's really where we get our satisfaction.
Yeah, that makes a difference, yeah.
Yeah.
Then, does teeth whitening actually weaken your teeth or damage your enamel? Does that happen?
Firstly, before we even perform teeth whitening, as dentists, we first will perform a professional assessment to make sure that you're even suitable. So if existing conditions such as dental decay or very bad gum disease, we won't even recommend teeth whitening in the first place. But as long as your teeth are suitable for whitening, there is absolutely no long-term damage. Initially, it does make your teeth maybe a bit more sensitive.
Yeah, I was going to say, you get that tingling or that
Yeah.
sensitivity, right? That's normal.
That's completely normal, and usually only lasts 1 day, maybe up to 2 days.
Right.
And it's usually the discomfort is quite manageable. Usually, if you just use a sensitive toothpaste, you pop a couple of paracetamols, that would manage it. And after that, there is no long-term damage. So even if you do whitening repeatedly, it's actually very safe.
How often can you repeat the whitening? Or how often should the whitening last?
People repeat them to get amplified effects. Sometimes
okay.
we have patients that even have 2 whitening sessions in a span of just 1 or 2 weeks.
Oh,
and that's
wow,
perfectly
okay.
And for patients that refresh their whitening, they can do it as soon as every 3 months, 6 months. It's really up to you.
I see.
So there's no hard and fast rule as to how often you can do it. But yeah, I would say if you just want to maintain it, there's no harm doing it like twice a year, once a year. And if you want to amplify the effects of your first whitening session, there's no harm doing it even in the next few days. There's really no issue.
Okay.
What I've noticed as well is that amongst us Asians and the Caucasian population, there's different kind of trend in terms of how you look, right? And you
Yes.
know, what are the different standards and what is your approach towards, let's say, a typical Asian patient like myself compared to a Caucasian patient?
I think this is something that's also quite interesting because aside from even cultural or different nationalities, our perception of beauty is different. Even between males and females, we also have different standards of beauty. For guys, we usually want to become more masculine. For ladies, we try to make them more feminine. And the degree of which we do that also matters. For example, if you're a guy, like for yourself, if you are...
I am a guy.
You are. But if you are more into...
that's how I
identify as...
no wrong with...
But if you're more keen for that K-pop look, you may not want to be as masculine as some of my Caucasian patients that come in, where they really want a very chiseled, square jawline, very defined cheekbones, stuff like that. You may prefer something more with more definition than females, but still a bit more V-shaped, in line with what you feel is...
I would love to have a more square jaw. How would you go about doing that for me?
So that can be done a few ways. Okay, first off, we're definitely going to have to try and define the jawbone for you. Two things we can do. For example, if your masseter muscles are very strong, so those masseter muscles are the muscles that we use for chewing, and it's the ones, this square muscle on the side over here. We can actually help to slim that down a little bit with things like jaw Botox. Coincidentally, I think for patients that grind their teeth a lot, I think we do get quite a few referrals to help with that. So when that is a bit smaller, naturally the jawline gets a bit more defined. What we mentioned earlier with things like HIFU, so if you're a little bit on the heavier side with a bit of jowling, HIFU can help to actually give you a more lifted look and define the jawline a bit better. Lastly, for a quicker and easier fix, sometimes we can cheat a bit with a bit of fillers, define the cheeks a bit better and define the contours of the jaw a bit better. And that gives you a bit more of a squarish jaw. But it can also be done in females as well. We just need to angle the proportions a bit better to feminize it. But again, back to difference between, say, maybe Caucasian patients or Asian patients, I think it also does come down to the influences that we are exposed to. So again, like for us in Asians, especially in Singapore, we take our inspiration from Japan, Korea, Taiwan, more local Asian features, and they are a bit more about skin quality, about skin texture, and making the skin the best it can be. We are not really into over volumizing as much, whereas for some of my European or even American patients, they like the volume. So for fillers, they wanted something to be a bit more outrageous. They want to see the effects of it versus, let's say, my Asian patients. So it's something that I think we do discuss, and I think for you guys as well, even when you're designing the veneers, the smile and all that, I guess we always have to chat and find out what exactly is their inspiration, and sometimes we also have to guide them, because it may actually end up looking a bit funny if they do something that is actually a bit too out there.
On that note, it's quite interesting because there also is somewhat of a difference between our Caucasian and Asian patients as well, even when we come to designing veneers. For example, a lot of people, they say, I want white teeth, but when they actually get white teeth, it looks very artificial. For us Asians, because we have a tinge of yellow in our skin, so if you go for teeth that is white as your toilet bowl, it's going to stand out. You're going to walk into a room and you're going to blind everyone there.
Is it fluorescent?
Yeah, it's fluorescent. It's too contrasting, right? So we do have to complement our skin tone as well. That's why for my Asian patients, I do advise always going for veneers that at least still have a hint of yellow to it, a small hint of yellow to maintain that natural look. But of course, if you really want to go all out white, I'm not going to stop you, but it will be something that is immediately obvious to anyone that you speak to. Even my Indian patients with more brown skin tones, these patients can actually go for very white teeth because it complements their skin tone. It matches better than it would with an Asian, with a Chinese, Korean, Taiwanese kind of skin tone. So yes, we do weigh the color of the teeth, and aside from the color of the teeth, we also look at the shape of the teeth.
Yeah, because my wife actually had veneers done recently, and I think initially when she was going through the plans and all that, she insisted that she wanted it to be of a certain height and of a certain alignment to look straight. But then what we realized was that when she smiled after that, it looked too perfect. Is there such a thing?
Absolutely. Some of the patients even request some imperfections.
Slight
imperfections. So the edges, we can make it look a little bit chipped. We can make the symmetrical teeth not so symmetrical actually. And we can even incorporate some of the original mild crookedness of the patient's teeth so that they don't look like a different person. And additionally, we also have to look at the shapes of the teeth that complement your face. So people have different face shapes, right? For example, if you have a very round face, you go for very squarish teeth, it doesn't complement your face shape. So Even though you might see, oh, I like this person's smile, this celebrity's smile, it might look good on them, but it might not be the best option for you as well.
True, yeah. And I like what you say about looking at the person as a whole and then making the decision so that you're not transforming the person totally, but you're actually keeping their unique features the same. But I think there's also a difference between, let's say, softening the effect or minor imperfections versus a botched job. So even for aesthetics as well, that's where you got to look for someone that is skilled in the area, that has been practicing it for a while, because there is a difference between a botched job and something that just looks at more natural results. For example, say with Botox, or like you mentioned with the veneers, or how white your teeth actually ends up becoming.
But if you do face a patient that comes in with a botched job, what can you do for them?
It really depends on what has happened. For example, for processes such as Botox, or even with, let's say, overdone HIFU or stuff like that, then unfortunately, a lot of these things, we do need time to wear it out. So for things like Botox, it's about 3 months later. If you really do have a droopy eyelid and stuff, we can do things like we can try eye drops, we can try massage or a bit of radiofrequency heat to actually try and speed up the dissolution of the Botox a bit faster. But ultimately, it does come down to time. If it's because you're a bit too sunken, you just got to wait for your body's natural collagen and fat to reproduce itself. But if it's things like fillers, if it's overdone, then luckily for that, depending on the type of the fillers, if it's hyaluronic acid based, we can dissolve it away, and that result is usually quite immediate. So it really depends on what the complication is.
So would you advise against patients going for non-dissolvable fillers?
There's no real easy way to answer this. It does come down to doctor preference, but what I would say the most important criteria for filler selection is the place you're going to do it, the skill of the doctor, and the doctor's knowledge of how much to put, where to put, and how to put it. I think those are the factors that affect safety a lot more. Advantages of hyaluronic acid fillers are, of course, that it can be dissolvable. So if you don't like the results, or if there's a complication, of course you can get rid of it easier. On the other hand, with things like biostimulators or those fillers that are non-dissolvable, they often have advantages in terms of more collagen production, and they do tend to last longer. For example, HA-based fillers is about 9 months to a year, whereas the others can be about 1.5 years, 2 years, depending. In terms of that, if you're looking for something that helps to build your collagen production and everything, of course the advantage would then go to fillers that are possibly non-dissolvable. So at the end of the day, I really think it comes down to the comfort level of the practitioner, and as well as making sure that you choose someone that knows what they're doing.
On that note, are there particular areas of your face that are considered to be higher risk, where perhaps I as a patient might tend to go more for the hyaluronic acid-based fillers?
There's no easy way to say this, but actually every area on the face is a potential danger zone. There's no real area that you can say that there's no risk. We can just say that maybe there's a bit of lower risk. For example, the cheeks, they're slightly lower risk. Because the truth of the matter is that the entire face is very highly vascular, meaning there's a lot of blood vessels there, and a lot of the blood vessels, any of them can be compromised, and that's where you can get things like necrosis of the skin, pustules forming, or even blindness. In fact, the cases of blindness that were reported with fillers actually tend to happen from, I think, chin and nose fillers as well. So they're not really at where you would think under eye, where I'll be worried that can cause blindness from that.
In fact, the recent cases of blindness, as far as I've read, actually was caused by HA-based fillers because it wasn't dissolved in time.
Yeah, so that's where, again, I would say going to a practitioner that is competent, is experienced, is very important, because the main thing about complication management, even in dentistry, I'm assuming, is going to be identification of the problem. Of course, we do it as safe as we can to avoid the complication in the first place, but if it happens, the first step is identification and then knowing what to do in that situation as well.
I think, that's very important. Ultimately in life, as the French say, happens, we need to know how to deal with it as doctors and as dentists.
Correct. Back to your side, are there cases where cosmetic dentistry ends up looking a bit too unnatural, and then what can you do to also sort that out when we're on this topic of complications?
It's a very common question that my patients ask me. Would it end up looking too obvious and too unnatural? The fact of the matter is, you only recognize the smiles of people that are unnatural because they look unnatural. You're never going to notice those that actually look natural. The answer is, it is up to you how you want it to look. So at least the way we practice at Brightside Dental is that before patients even get the actual veneers on their teeth, they undergo a trial period first, where they actually have a trial set of veneers on their teeth for at least a week before we actually place on the actual veneers. And those trial veneers will give you a very good idea of what the outcome is going to be. So if you tell me that the trial veneers, they look too unnatural, great, tell me so that I can actually change it. I can even do a second trial for you to make sure that there is nothing lost in translation and you get exactly what you want. I've had patients come to me as well that they have actually brought their old photos from perhaps 10, 20 years ago, and they say, yeah, I want to just have my old teeth back, and we replicate that as much as possible and it looks very natural. Even if you want your veneers to look yellow and stained, we can do it as well. Do
you recommend that?
It's up to you. Okay. Beauty is in the eye of the beholder,
okay,
right?
That's
so
true.
If you really want to just restore what you were looking like a few years ago, and if that was what you looked like, by all means. So yes, it can look as unnatural or as natural as you want it to be.
Have you ever got cases where it's too natural and then they say that, hey, no one can tell the difference?
Like I said, because they go through the trial and that's ultimately what they want. That's what they want. So fortunately, I've not had cases that have been lost in translation thanks to the trial period, which is super, super important.
And I think communication,
yes,
finding out what they want.
Yeah, we always go through a questionnaire for patients. For example, any particular friends or families who's or celebrities whose smile you really like, you can send it to us. I'll run through the gamut of colors to get the range of shapes of teeth to really get a good understanding of what they want. Then we design it and we trial it. If the patient doesn't like it, we trial it as many times as they want until they actually get what they want. So the actual ones, it never comes as a surprise.
Sounds great.
I always wanted to know, if I didn't want to actually go, for example, under the knife, or I didn't want to do any Botox or fillers, what is your advice for me if I wanted to just have as good skin as I can by doing stuff at home?
Okay, taking care of your skin is pretty much like going to the gym and working out. What you actually do in terms of cosmetic procedures is only about 20% of the whole thing. Just like what you're doing and when you're working out is about 20%. The main thing is your diet, the rest of the 80%. So your routine at home, what you do for your skincare, your lifestyle, your habits, these make up the 80%. So of course, things like being healthy in your lifestyle, smoking is a definite no. There's no benefits at all. But in terms of things like alcohol...
Looking cool. Not anymore though.
Not anymore, I don't think so. Yeah, I think the trend is shifting from that. Even vaping, there's no benefits in terms of skin or your health. That one's a definite no. In terms of diet, exercise, you should have it in moderation, even things like alcohol, because again, indulging in too much of that will also mess up your skin and the skin's natural biome as well. Of course, your skincare is going to be very important. Having a good cleanser, moisturizer, a good sunscreen, these are the three basic things I think everyone needs to have, be it male or female. And of course, once you get a bit more adapted and your unique skin needs, then that's where you may add on a bit of exfoliation, that's where you may add on a bit of retinols, acids, to complement your skin, or if you need more hydration, more moisturizers to it. But I think these, especially in Singapore, a good cleanser, a good moisturizer, and a very good sunscreen, I think that will be important. If you really didn't want to do anything, the last advice is try to avoid the sun as much as you can, because one of the main leading causes, aside from your genetics, is extrinsic aging, and that comes around with things like sun damage, environmental factors, pollution, all that happens.
Is there really a stark difference between, let's say, a brand name sunscreen or cleanser compared to a more generic and expensive one?
Okay, I would say that it comes down to what is suitable for your skin. What you're paying for probably does make a difference to a certain extent in terms of the quality of the products. But at the same time, you have to test it out on your skin, because everyone's skin is different. What might be suitable for myself may not be suitable for the patients that I recommend to. So we generally have a variety that we can suggest and offer to patients, because if it's something that's a bit too sticky, a bit too oily for your face, then you're not going to want to put it on. If it's something that causes blackheads and whiteheads to pop up or acne to pop out on your face, you're also not going to apply it. So it's about finding what works for you. It can be a bit time consuming, it can be a bit laborious to actually go through the process. But once you find something that works for you, then just stick with it. I mean, I don't think that I would recommend, unless you really want to, like switching brands every 6 months or so. You don't necessarily need to. You just find one that works and stick with it.
I mean, you have great skin. What's your routine?
So I do the basics. I have a cleanser. I also moisturize as well. I use a men's sort of solution all in one. But then I do follow up with a HA serum in the mornings, as well as sunscreen, SPF 30 to 50. 50 if you can, that'll be the best. And nighttime, I actually do use retinols as well. well because I actually have very acne-prone skin, but not all the time because there can be a bit of side effects. It does dry it out, so I do balance that with a face mask from time to actually hydrate.
Okay, so Paul, that was very educational for me. I've learned so much.
Same, there's a lot of things about dentistry. I mean, different fields, so we sometimes don't get to ask these kind of questions.
Yeah. Ultimately, it's about being healthy.
Yeah, in totality as well.
Yeah, so if you look good, you feel good, yeah?
Exactly, yeah.
Alright.
Thanks, guys.
Thank you.